Now I can find it. Then go to the full screen mode. And it takes some time. Mhm. Can you see the slide full screen?
Yes, doctor.
Mhm. So as you see,
No, not full screen.
is it not? It's not full screen. Mhm.
No.
I see. Let's do it now. Mhm. So is it full screen?
Yes.
Yes.
Okay. Good. Well, and so we are starting the new unit. This is unit 3, instructions and procedures. And so first, there are some comments about the home assignment, the previous homework that you've done. You can see several screenshots from students' papers. And you remember that the task was to watch the video and to complete the form in the text document, so in the text file. So everything was all right, but some students just maybe misspelled the name of the symptom that the patient has. And there were some mysterious phrases in some students' papers, like the symptom soft throat. I can understand this because this is about some problems in the throat. At least the part of the body is written correctly. But some students wrote just something about food. If you feel that you don't understand something, so please consult the dictionary. It's not a problem nowadays. So as you see, the correct version of the spelling was sore throat, like here on the screen. So be careful, please, with the spelling. This is part of the language, and so we should know this. Well, do you have any questions about the home assignment?
No.
I see. And I need to just to understand who is here. Has Aon come? Aon Moht Sharif Naif Hashashnek. No? Minus. Okay. Bah Tavaris joining us. Ibrahim Nasir Hassan. No. Is Roa here? Roa?
Yes, doctor.
Okay. Rola is here.
Yes.
Okay. Yara is here. Bakhtavar?
Yes, doctor.
Okay. Susan?
Yes, teacher.
I see 1, 2, 3, 4, 5. Just 5 ladies have come. Good. So it's so. I mean that several students are missing, and we are writing the midterm test today. So I don't know. And it looks like Abdallah will try to write the test. Yes. Yara, what do you know about Aon? Where is he?
To be honest, I'm trying to call there. There is no
Doctor?
answering. And maybe he have a problem with connection, because I think his connection in the home is so bad, because he come to Almaty from few
Doctor,
few a
I
day.
just texted on. He said he texted you about not being able to join because he will be joining group 6 later.
Mhm, mhm. I see. So he means that he will join he will take the test with group 6, right?
Yes.
Mhm. I see. And Abdul Rahman. So
He
is
is absent. We don't know why.
I don't know why. Because I've just seen him only once. Mhm. I see. Okay, then there is yes. Okay, 1, 2, 3, 4. Mhm. Okay. Well, and ladies, let us move to the next slide. Here you can see several pictures. And the question, what is happening in the pictures and what do you think happens before and after? Yes, Roa, in picture A, what is it?
Yeah, picture A, I think this is a new doctor, graduation, is asking a patient to get undresses. The doctor take a case history before the scene in the picture and afterwards examine the patient.
Mhm, mhm. And you can see that the doctor is holding some piece of clothes in his hands. So it means that he will ask the patient to undress just and then to examine. Yes, well, our own is joining us, okay. What about picture B? Yara, please.
Okay, it's the journal doctor is writing, as I see in the picture, and what and history notes. I think she's do a history notes, and the doctor perhaps took a case history, and what else? Yes, after writing the notes, I think she just showed the patient, so another patient.
Yes, it's written, so another patient. I would like you to speak, not to read from the book. Okay, so Bahtavar, picture C. What can you see?
Doctor,
Mhm.
Doctor, in this picture, the doctor are checking the patients. It seems that he has some problem in his throat because the doctor is checking her mouth, and also
Mhm.
there are some nurse here and also.
Mhm. Okay, possible. Yes, just the nurses just assist the doctor. And is it possible that the doctor is giving instructions to junior doctors? He's showing some kind of procedure, and then these junior doctors will repeat the same manipulation, right? Because it's
Yes.
very important. This is a very common process that doctors should study every day, and so this is the teamwork. That is why somebody who is more experienced just tries to teach the other doctors something new, like here in the picture. Well, and there are 3 more pictures here. So picture D, Susan, what is there in picture D?
About the picture, the teacher, we can say that there is a patient, here is a patient, and they are all doctors, and they have a good connection with the patient, and they are talking with how can I say, they have a smile, and I think this man is, maybe it is a doctor, or maybe he is a doctor, or we can say he is maybe, or maybe
Consultant,
I
right?
forgot. Yeah, of the hospital, and
Mhm.
it shows that how their attitude with the patient.
Mhm, mhm. Yes, they are smiling. It means that they try to encourage the patient to help him to calm him down. Mhm. Okay, and what do we call this room? Where are they now, Yara?
Maybe emergency room.
Maybe emergency, right? Yes. Mhm. Okay, and so the next picture. Yes, Yara. Picture E.
Okay, I think the doctor just talked with nurse. Maybe he's nurse.
Mhm.
And talking about patient, maybe about the case which they have.
Mhm.
What else? Yeah, it's
Yes,
like discussion with the nurse and the doctor.
exactly. So one of them is holding some results, so the case history or results of the some medical tests. Mhm. And the last picture, Roa, please.
Yes, doctor. I think a doctor feels sleepy and tired and just wants to sleep. I think he has been working for a long time and his work is finished. Um, maybe the doctor is lived in the hospital.
Mhm. Yes, and what are they discussing? What do you think they're discussing?
I think he is write a list of particular jobs to be done.
Okay. Yes, or just some information. He's just showing the next doctor who has come to her shift, to the morning, for example, shift, the information about the patient, what happened to the patient or what was done during his shift. Okay, so these are the common situations in a hospital. And as you see, doctors just normally work in teams, and communication between doctors is very important. And so if we move to the next slide, there is a definition to the word ward. So like, for example, okay, so definition is a ward is a separate room in a hospital, typically one allocated to a particular type of patient, like in picture D. So this is a ward in a hospital. And if we focus on this word, can you just remember, do you have any experience in a ward for the first time? Have you ever been in a ward?
Yeah, I have been.
So your name?
Yeah, my name is Rela.
Rola, please. So
Yes,
when was it?
so like 6 months ago, after my surgery, I had an infection, but they didn't know where the infection was. So they were discussing about where they think they should do,
Mhm,
what tests and what procedures
mhm.
they should take. Yes,
And did the doctors help you?
yes, they did. I was fine like in 2 weeks.
Mhm. Were you satisfied with the work of the doctors?
Yes, so much.
Uh-huh. Well, it's very important for the doctors to be professional, to discuss everything. Yes, this is the way they can help their patients, because so their conditions, the state of their patient is very serious if they are in a hospital. Okay, and there is one more phrase we should remember. This is ward round. So the ward round is a visit of a doctor in a hospital to each of the patients in a ward. Not only one doctor usually visits the patients. This is a group of doctors, maybe some nurses. So they do the ward round in the morning every day, just to understand if the patients make any progress, and maybe prescribe something, some new medicines or some new procedures, just to the patients to treat them. Well, and now imagine the situation that we are going on our first ward round. And so here are some tips for the first ward round. Why do you think each tip is given? Why is it important? So let us read them and comment on them. Is Aon here? Aon? No, I thought he was.
Doctor,
Yes.
can I answer?
Just a minute. Yes, he has left us. Yeah. Aon. Yes, please. The first, will you read the
Because
first line?
yeah, you want from me to read. I think you want to explain why we
Okay.
use we
Yes,
know
please explain.
the names of patients, because we can't get confused of the patient and the cases.
Yes, so we understand which case is about which patient, right?
Yes.
Exactly, it's very important. Yes, what about the next line? You can comment on this. So,
I can.
yes, your name?
Rula, they need to know where the patients have been moved to, because they need to move quickly to them to get to them easier.
Yes, sometimes doctors don't know about moving the patients, and they need to find to talk to the managers, yes, just to understand where to find the patient. Okay, so Susan, please. Line C.
About the C, we can say that we have to know we have to check all the things that it is related to the patient, because we know about the situation of the patient, what changes, what are the changes that is coming in his or her body, and I think it's important to check all the case notes and the investigation.
Right. Okay, thank you. Well, Bakhtavar.
Yes, doctor. Invite a nurse, because she or he maybe know about the condition of the patient very well, and about the basic condition like the pressure, about the heartbeat, and this information may help the doctor to diagnose better.
Yes, exactly. And the last line, who will read it?
Can I?
Yes, please.
Okay, we can record the case histories and results clearly and consistency, because if the patient come back for us, we know the situation for patient, so we can we can give them the medicine as his situation and his last case.
Okay, and sometimes the patient needs just some other doctors, consultants, just to get the right diagnosis. That is why the other doctors should be able to read the records in case histories and just to understand the information. And also if we deal with the medical tests, so we need to understand so the results of the tests, they should be given clearly. Well, so we've thought about these tips. Do you think, so if we move to the next slide.
Unit 3.
Just a minute. Now, well, here we are going to listen and complete the reasons given for each tip by a doctor. So you can see she's explaining why each tip is important. Like, for example, if we have a look at line A, it says, as you want to demonstrate that you are, it means that she's commenting on the first tip. Make sure you know the names of your patients and where they are, as you want to demonstrate that you are. If you have the book, this is exercise 3, not sure about the page 20. And so the beginning of the sentences, the tips themselves are given in exercise 1, the same page. Now we'll listen to the doctor and write several phrases that follow these sentences, okay? So I'm going to turn it on and you'll tell me if you can hear.
Unit 3.
Can you hear?
Yes, doctor.
Okay, now.
Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Mhm. So do we need to listen for the second time?
Yes, please, doctor.
No.
Unit 3. Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Mhm. Well, so what did you write, Roa? What did you write in line A?
Yes, as you want to demonstrate that you are, I think, familiar with your patients.
Mhm. Yes, familiar with your patients. This is about just knowing their names of your patients and where they are.
Yeah.
Okay, so the next line B, let us listen to Rola.
To avoid wasting time running around looking for patients.
Mhm. She says, wasting time, especially the consultants running around looking for their patients. Okay, Yara, please. Line C, Yara.
C.
Yes.
Okay. Check if a patient move, so that you can the patient on the wards. I think it's wrong. Or no, maybe it's refresh to them quickly.
Yes, so that you can refer to them quickly. Okay. Bakhtavar, please.
The doctor should invite the nurse because they are more knowledgeable about the patient.
About the patients on the ward than you are. Yeah. And Susan, please, the last line is for you.
You have to shoot correctly and very well that check them, and that in that way you can understand the patient situation.
And what exactly did the doctor say? In that way?
Teacher, in that way you can understand the situation.
Yes. Who has written the exact phrase which was said by the doctor? You can help us.
Can
For
Yes.
I think in that way you can access information easily.
Exactly. Access information easily. So information about the patients. Anyway, so the idea was the same. Good. And
Unit
so
3.
if we think of the tips, the advice that are given to junior doctors, would you give the same tips to a junior colleague in this situation? What additional advice would you give? So if you come to a ward round, so are there any more ideas just to help the doctors to focus on the patients?
Do not stress out.
Uh-huh.
To be calm all the time and think on his feet.
Yes, any way to show that you are confident, right?
Yes.
Mhm. Yes, very good piece of advice. Mhm. Yes. Any more ideas? Okay, okay. Thank you. And so if we move to the next slide, let us have a look at the information here. So the question, why do you need to do these things before you carry out a procedure? And here is the first idea. We should obtain consent from the patient for the procedure. So consent means agreement of the patient. Normally, it should be done in a written form. So a patient signs some contract, agreement, consent document. And just why do we need to do this before the procedure? Roa.
doctor.
Yes, Susan?
No, I'm Yara.
Okay. Susan has raised her
may-
hand.
Okay, I'm sorry.
Yes, Susan.
Teacher, about this question, we can say that before we have to do till we have to take the agreement from the patient because of the procedure, because maybe if the patient may be faced with another problem during his or her for example surgery, and we can say consent is something that it is lawful and it is legal, and it's important to take the consent of a patient.
Mhm. Okay.
so-
Yes. Yes. Any more ideas?
Yes, maybe he have risks in his surgery and maybe he is going to be die.
Yes, and he should be aware of this. So
Yes.
This is like a kind of doctors should protect themselves from this also from these risks of being accused of patients' death. Yes, problems. And the patient should be aware of these risks, and so this is very important for both doctors and patients. Well, and so why do we need to? Why does the doctor need to introduce himself or herself? Yes, Roa.
I think it is so important because the patient is physiology comfortable and know which doctor will treat him, and be confident that a good doctor will try him.
Yes, yes. When you know
It's very
some,
important.
yes, someone just in person, this is you trust this person. You can just understand who you are talking to. Okay, and then why is it important to prepare the trolley? And what is the trolley used for? Why is it important? So let's listen to, well, Roa, please.
So the trolley is to prepare equipment in it, and you have to prepare them because you don't want to have a missing item for the
Mhm.
procedure.
Yes, and what is the trolley for?
For the equipment to be prepared.
Yes, yes. So everything should be on hand, just easy to access. Great. And now I would like you to look at this slide here. Here we can see instructions for a procedure. We don't know what kind of procedure, but we need to use the words to complete the instructions. So you can see there are some gaps, and so we need to complete the gaps with the verbs like prepare, mark, attach, wash, sterilize, drain, obtain, withdraw. So I guess you know the words, like attach means to connect, to tie something together, or obtain is to get, withdraw to take away. So, and if we have a look at the first step here, this is about the stylet. Stylet is a kind of a catheter or tube that is used in some procedures with human body. And what do you suggest to use in the first line, the stylet? What should we do with the stylet?
Can I answer?
Yes, please.
Withdraw.
Withdraw, possible. Okay, what are the other verbs that we can use here in this sentence?
Attach.
Attach also possible. Okay, yes, right. What about line B? So you can see here in this line, there is abbreviation CSF. And if we look below, this is CSF means cerebrospinal fluid. And also in line C, there is the letter L, it stands for lumbar vertebra. So what do you suggest to use in Yes, in line B, Yara.
In line B, maybe drain.
Yes, because there is the word such words as fluid and drops of fluid. So just they show that this is the procedure, some manipulation with the liquid, right? That is why drain is the best word to use here. Drain 10 drops of cerebrospinal fluid into the tubes. Well, so Bakhtavar, what do you think of sentence C?
Sterilize the patient between L4 and 3 where the needle is to be inserted.
Sterilize the point. Okay. Is it the only possible verb that we can use here in this sentence, sterilize? Or can we use the other verbs?
Doctor, the
Can I
yellow
answer?
one is
Yes.
Doctor, the yellow one is unreadable, but the other I don't think so.
Okay, so who can think of another verb here, ladies?
Mark the point.
Mark the point. Yes. So we need to understand where to insert the needle. So mark the point is also possible here. Okay, line D is about hands. It looks like we have less than 1 minute, ladies. That is why we will stop. We'll pause our